COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, and food assistance. COVID-19 recovery.
Hi, I'm Kelly Vaughn, and welcome to COVID-19 recovery, where we look at how to recover from the pandemic and beyond. In fact, we're taking the show beyond the pandemic into wellness overall for our community. And also joining me on the show is...
Hello and good morning. Al Bracken with Community Action, and obviously glad to be here. Thanks, Kelly. And from a community action perspective, I just wanted to remind everybody, as we do every week, that we started out the show and our wellness initiative vis-a-vis the CARES Act, looking at health disparities among the Black and brown communities. And in doing that, we took the mind, body, and soul approach to wellness. And over the last year and a half, we've been all over Marion County working with various churches and civic organizations, et cetera, doing health fairs, health awareness, roundtables, you name it, we're doing it in the community to look at health disparities. And right now we're in a transition period to look at how do we maintain this momentum of excellence in healthcare in what in many cases is healthcare deserts in our communities. And as we grew our program, one of the main things we started to see was just the fact that our people just are not going to the doctor. So we've been working with a lot of organizations, especially Shalom Health Center, and referring folks to the doctor that can't afford, to be there, can't afford to go. We've been providing transportation. We've been providing resources for individuals all over Indianapolis. One of our primary groups has been our pastoral roundtable led by Leroy King of LK3 Consulting. So in that, I just want to talk briefly about a couple of upcoming events that we have in May. On May the 11th, we're doing a long COVID workshop, a focused roundtable with our clinical staff from 6 to 8 at the Arts Center of Meridian Park. And that is going to be a small focus group that's going to be focused on coming up with solutions for wellness that are more sustainable moving forward. Also, on the 21st of May, we're going to be at Garfield Park with the Haitian Association of Indiana and Chase Bank and Community Action participating in their Flag Day. We will also have the health department, Devery Webster, and Shalom will be there as well with our pop-up clinic. And we're going to be working with Chase Bank to do financial literacy right there in the park. On the 26th of May, we're going to be back at the Arts Center of Meridian Park, and we're going to be doing a focus group on domestic violence in the faith community and beyond. And many of you may remember Myra Cassidy, who was on the show about a month ago, and she's going to be facilitating that focus group. If any information, if anybody wants to attend these events, please text me at 317-695-0919. Just a text at 317-695-0919. Also, we want to remind everybody that this is National Mental Health Awareness Month. Now, we should be focused on this all year, but we've got a focus month for May, and we've got the perfect guest with us this morning to lead this off and give us some boots on the grounds interpretations of some of the things that we're seeing. One of the trends that we're seeing in Indianapolis is violence in our communities, and is obviously getting out of hand. But one of the stats that's not being talked about enough is the growing suicide rate among young African Americans, and not only Indianapolis, but in the United States. So we've got Richard Samuels on this morning that's going to talk about his fantastic, exceptional boots on the ground organization, Growing Indy. Richard, how are you doing this morning?
Doing great, Al. Thank you for having me here on your show.
All right, tell us anything and everything you want us to know about Growing Indy and all the good work that you're doing in the Indianapolis community and beyond. And then we'll get into a couple other things in reference to that, but let everybody know what you're doing and then we'll go from there.
Well, the Growing Indy Group is a 501c3 nonprofit that is committed to, basically investing in justice-involved individuals and their families, as they make the transition back into the communities after incarceration. We work alongside these families and help them kind of overcome the barriers while investing in their efforts to be, productive citizens in our society. So we really find ourselves, especially with the advent of COVID, as well as the mental health issues, it's difficult out here. You mentioned the suicide rate, and a lot of the things that we do is basically making sure that we're coming alongside those families and really counseling them and talking to them. The COVID was really, really ugly because it put them in a position where they were not, a lot of times, in a position to be able to say goodbye to their loved ones. There was a limit as to how many people could come up and visit in the hospitals. Those type of situations were alarming. And so you can only imagine with people that are already struggling with just the basics. Now with the advent of COVID, now with the rise in the suicide rate in terms of their loved ones, their young people especially, it's concerning.
Wow. So tell us a little bit about how you go about making a difference with families and those who are recently released. And I was looking at your website, talking about services, education, training. Can you break it down for us so people can get kind of a visual of what you're all about?
Absolutely. So basically we have a trauma-informed approach to the social determinants of health over 8 different kind of domains: housing, healthcare, mental health, substance abuse, transportation, education, employment, and a lot of the food insecurities in our city. We try to improve the quality of their life through a circles model. And so basically a circles model is where we will have an individual in the middle and we will surround them. And we will provide, holistic care, not just one problem, but we want to deal with all the problems. So if you have one individual coming out of incarceration, you have to recognize that as you provide care and services to them, if you send them back to an environment that's not conducive, then all the things that you've done don't add up to anything. So basically we've made it a point to address the family situation as opposed to the individual situation. And it's just so much more a dynamic, there's so much more information that individuals can not only get, but the family structure get as well. And learning how to navigate different systems. So say you have a loved one that's incarcerated, who do you call when that loved one comes down with COVID? Or who do you call when you have a COVID question in terms of the DOC? Those type of things. So we kind of utilize ourselves as a clearinghouse as well about information about the Department of Corrections, where they need to go, who they need to call in certain situations. Now, when they come home, it's a whole different situation because now the COVID situation that you may have been dealing with while you were incarcerated is completely different when you come out here into society. And so trying to understand the different norms and the different aspects of dealing with that. Mr. Bracken talked about suicide. There's such a sense of hopelessness throughout our community based upon the fact that there are so many difficulties that people have to deal with. I was fortunate enough this past Thursday to be the keynote speaker for Use What You've Got Ministries, Cecilia Whitfield, and her wonderful organization that provides transportation to families who are wanting to take their loved ones to go see someone incarcerated. And they wanted me to talk about mental health. As well as, and the reason that they had asked me because I also did a speaking engagement with Cafe, talking about mental health services. Mental health is so very, very important because it's the little things in terms of mental health that people don't realize that are big issues for those suffering with mental health issues or challenges. And I call them issues or challenges because, you can be looking at schizophrenia, bipolar disorder, anxiety, but rarely do people understand that fear can be a mental health. Just the aspects of fear of failure, couple that with low self-esteem, couple that with trying to figure out how you're going to pay the bills on a regular basis, those type of things, all of that together really create a situation mentally that is debilitating in some aspects, and basically the reason for that lack of hope in our community.
Okay, and sums up to pressure is the word that I thought of when you were saying the fear and things going wrong and whatever's going around you. So a lot of pressure, and then we know what happens when anything is under pressure. Yes. Oftentimes, even if it's on the stove, it explodes, it overboils. So we want to finish our discussion about that and more. We're going to take a break, and when we come back, we'll continue our discussion with Richard Samuels and his organization, the Growing Indie Group, after this.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
Welcome back to COVID and Beyond with our CAGI and Kelly Vaughn and our guest for today, Richard Samuels. And as we said before, that Richard is, I know, and I've known Richard for a few years and I've seen some of the work that he's done. And just to hear the first segment, it just brings so many memories and thoughts in reference to more questions that we're going to buzz Richard with, because we're going to have to bring him back real soon. And I'm going to invite Richard in front of our crew, our whole audience, to come to be part of our arts, the arts in the center at Meridian Park, to do a roundtable on this topic that will be fully sponsored by CAGI, hopefully sometime in June. But Richard, let's get back to kind of what you were saying. And I'm interested as an older Black man who used to be a young Black man, the pressure that we put on ourselves to pretend like we're something that we're not. I want your opinion. You're not a mental health professional, but you spend more time with these kids than anybody else that I know. So kind of speak to that and the pressure that we put on each other through social media and what that ends up either in violence or in suicide. So can you kind of address that a little bit?
Good question.
So there are so many things that I feel, especially in terms of social media, that lead to, as Kelly shared so eloquently, that pressure. Pressure busts a pipe. You know what I mean? And so, just the need to fit in, I don't think that we as older Black men understand the magnitude of how much that has tripled and increased in our younger generation, based upon the fact that, it's not the face-to-face interactions anymore. It's the social media that haunts you, that follows you 24/7. And if it's something, in terms of bullying, something ugly, you can't get away from it. And, of course, all you have to do is look at how many times people look at their phone, how many times people handle that instrument that connects us all. And unfortunately, if there's something negative going on there, it stays with you constantly. And so it puts our young people in a situation where, everybody wants to fit in, everybody wants to be included. And unfortunately, sometimes that's just not the case.
Yeah. And you just said something, brought back something else for me, the whole bullying part. A few years ago, I led a group with the National Guard called the Drug Demand Reduction. And we had an anti-bullying, anti-gang task force associated with it. And that's when, this was 10 years ago, and that's when I started to see the numbers start to rise on Black male suicides. And a lot of it was related to bullying. Dig a little deeper into bullying and how you see it manifesting itself in our young community, because I don't think that we see this or we hear about it enough. And we want to also have you talk about some solutions of marching orders and what we can do to help out.
Well, unfortunately, a lot of and I know this is going to sound a little off key, but unfortunately, a lot of our bullying situations start at home. And when I say start at home, I'm not saying that that our young people are being bullied from home. But unfortunately, sometimes our parents, the way they are raising our young people, put them in a position to be susceptible to bullying at school. Do what I say, not as I do. You know what I'm saying? And so our young people are so intelligent nowadays that it's like, so you're telling me to do this, but what I'm seeing on a daily basis is something completely different. And so then when I go to the school situation where there is so many people there, so there's maybe a lack of supervision constantly, even though there are cameras and this, that, and the other. But there are no cameras in the bathroom. There are no cameras in those hallways where, bullying is taking place. And so then what is my mental aspect in terms of when somebody comes at me the wrong way? How do I handle that? So now that goes back to how I'm handling things at home. Okay. And so therefore, it may not be that you're teaching me these ways intentionally, but unfortunately, you're making me susceptible to a bully by the way you're treating me as a parent to a certain extent sometimes. And that's not in every case.
Or how a parent might react to that situation where, say, a great-great-grandma might present it in a totally different way. Like now, turn the other cheek, go the other way. Where a newer generation mom who hadn't maybe been taught that or know any better, don't be messing with my baby. I'll come down there and fight you. Sometimes the parents jump in it and become a part of the conflict.
Now, when you say that, Kelly, the first thing that comes to my mind is, the parent is talking about, I'll come down there and do this. How close in proximity is that from, if that's what you're saying as a parent, then when do I get it in my head to pick up a gun and just go to school and shoot everybody?
Right, yeah.
You know what I'm saying? And so it's just unfortunate because of the way we're teaching them to handle conflict. I'm about to start some work with the Waters Community Center, which is under the Office of Public Health and Safety, doing conflict mediation, conflict resolution, because we recognize that with this suicide epidemic, we want people to be able to manage conflict in a way that's going to be conducive to both parties, as opposed to someone ending up with suicidal thoughts or suicidal ideations.
Mm-hmm. I think too, when it comes to suicide, that you have to be taught not to do that. I can vividly remember my mother laying across her lap when I was 5 years old and her talking to me and saying, you don't ever do that. You don't ever do that, no matter what, and that's always stuck with me. So through deaths in the family, there are times we all feel like, gosh, not so much like I want to kill myself, but I don't want to live. This pain, this emotional pain is so, how can you have something emotional hurt so much physically? But it comes from being taught at a little age, you don't do that. You don't, and that's always stuck with me. So we don't know how often somebody's not told that. And you're just down here thinking, well, maybe this is an option just to leave the world. And then you think too, sometimes maybe, especially younger people may think that they can come back like you do in a movie. You got the actor out there, he's killing up people and then you see him later and he's alive. Like you're not coming back, not here on earth anyway, you're not coming back here. So I'm not sure if they understand that, especially when it comes to young people, the consequences. And oftentimes too, you have to be taught the biblical principle that, I can't think of the scripture, but, the sun will come out tomorrow, basically, that even though you feel down, oftentimes, it isn't going to always be this way. Now, of course, that's general depression. Of course, there's clinical depression that is more the chemical imbalance of the body, which may not be affected by that tomorrow is going to be a better day. So I do want to recognize that too. But there, especially when young people, there are kids who take their lives that may not be so much from a clinical perspective, but as we talked about earlier, the pressure and wanting to get from up under that pressure. So,
well, and I also think, Kelly, that the media, in terms of what our young people are seeing on a regular basis, it kind of leads towards hopelessness. It's like, especially when you're constantly looking at police officers and police action shootings, those type of things. You're seeing the black on black crime, and you have to wonder, with all of the things that we are asking our young people to handle and manage and deal with, but without the advent of talking about the importance of them having someone to talk to. That's one of the biggest issues in terms of dealing with justice-involved families right now that we're looking at, is making sure that anyone that has been gone and is coming back from like 3 or more years, that we have someone that we can talk to. Because sometimes just being able to unload and get some of those different heavy burdens that we're carrying, unbeknownst to other people, off of our shoulders, I think is very, very important.
Yeah,
absolutely. Another thing that we have is, as we look at issues, whether it's health disparities, mental health, whatever it is we examine old problems and come up with new solutions. So we say old problems, new solutions. Richard, we know what the old problems are. What are the new solutions that you're looking at to address these issues?
Well, one of them was what I just shared, basically providing someone that our young people can talk to, having a therapist or someone that they can be sent to, that the cost would be covered by Medicare or Medicaid, something that's not going to create another problem for them or another hurdle that they have to jump over in order to be successful. So basically having that someone to talk to, and then having more people who are qualified in the areas of suicide, maybe in the school systems, maybe in places of employment, just like, back in the day when the schools had the guidance counselor, that was someone that you could go to talk to about what was happening at home. Whereas how many places of employment do you have where our young people are working, that they have that person that if they're dealing with a conflict of some kind, that they can just go in the office and say, hey, you know what, I'm kind of overwhelmed right now. Or I just had a customer come into the store and curse me out and talk crazy to me. Are we providing situations and avenues that our young people can reach and say, hey, I need some help, to reach out. So basically education is definitely important. Training definitely is one of the things that the Growing Indie Group is really looking at as well, in terms of making sure that we have those trauma-informed approaches, that type of training, so that people can understand why they feel the way they do. It's one thing to feel that way, but Are you even taking the time to trace it and connect the dots and trace it backwards? To find out, well, what it is that's making me feel this way? Is it a breakup with a boyfriend or girlfriend? Is it some trauma that's happening in the home? Figuring out what that is so that you can then effectively navigate your way through it.
Okay.
Absolutely.
Well, we're down to less than a minute, but I did want to say, wow, we certainly want you back for part 2. We could have easily done 2 interviews on this, but we appreciate you coming on and sharing and enlightening us, and all that you've done, beyond this organization. Because obviously, I know I wouldn't be here on this show with you if it weren't for you, because you're the one who brought me into community action in Greater Indianapolis.
Thank you for that, Kelly.
To that fine organization. So I appreciate you so much. And so I don't know if Al has any other last minute words to Richard, but I say thank you. So
Yeah, the same here. Richard's contact information is going to be on the screen. And we want to go past just, talking about this. We want to be action-oriented / community action and making a difference.
And definitely, Mr. Bracken, I'm definitely interested in that roundtable out at the park. And so just reach out to me and let me know, and I'm there for you.
All right.
Sounds good. Richard Samuels, the founder and executive director of the Growing Indy Group. Thanks so much for joining us here on COVID-19 Recovery.
Thanks, Richard. See you, Kelly.
Okay, bye-bye.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Serving Boone, Hamilton, Hendricks, and Marion counties, be sure to visit our website to learn about employment and education opportunities, food, housing, transportation assistance, and more. Apply today by calling 317-396-1800.
Hundreds of thousands of veterans have taken off their uniforms and put them away, carefully packed and safely stowed. But for some veterans, the uniform isn't so easily removed. The emotions experienced while serving continue to weigh on them. Life after service is different. Many veterans find transitioning difficult. Some feel overwhelmed and lost. But that uncertainty doesn't take away from their strength and courage, nor does it take away from the sense of duty veterans carry with them. The power of one person, one connection, one act of compassion can make a difference in the life of a veteran going through a difficult time. For free 24/7 confidential support, call the Veterans Crisis Line or visit veteranscrisisline.net.
When it comes to your money, whatever you want to get smart about, you can find at smartaboutmoney.org. Smart About Money is a free online resource. We are a non-commercial, non-profit organization dedicated to helping people just like you get information about money. For everything from how to build an emergency fund to how to deal with job uncertainty, smartaboutmoney.org has the answers you've been looking for. Smartaboutmoney.org, the easy place to start when you want to get smart about your finances.